Hi everyone, so today we're going to be looking at our third definition of abnormality. So we're going to be looking at failure to function adequately. We're going to look at the definition and use the key terms accurately and include an example of our own in order to understand best what this definition is. We're going to apply it to a situation to see whether we decide whether someone is abnormal or not, and then we're going to think about evaluating the strengths and weaknesses of this definition. So first of all, failure to function adequately. What is it? Well, people with psychological disorders often can't cope in general everyday life, so they're unable to function adequately and therefore are classified as abnormal. For example, if you had to wash your hands constantly in order to clean the germs off of you, and therefore you kept being late for work, or you kept not doing the work because you had to go and wash your hands, then you're not being able to function adequately within society. Equally, for example, if you can't get out of bed to get to work, and therefore you get fired because of it, because you can't maintain a job, that is functioning inadequately, and therefore you would be classed as abnormal. The key point about this is that the person has to be classified as abnormal because it's causing distress to them or to other people. And distress is a really important word here. We have to work out whether this is causing them distress or not. So you have to think about whether in this situation, for example, with someone washing their hands so often that they're late for work, who it's causing distress to. So it might be causing distress to the employer because the employer isn't getting any work out of them, and therefore they're not worth having in the job. However, it might also be causing stress to the person. The person obviously is agitated and anxious about having to wash their hands all the time, and they know that the reality of it is that they aren't doing their job properly, so that might also cause them distress. When you're applying this definition, you must make it clear how the person is no longer functioning adequately. So are they going to get fired? Are they not able to have functioning relationships with other people? Can they not maintain basic needs? If we're thinking about, say, Maslow's hierarchy of needs, those basic needs such as feeding yourself, clothing yourself, making sure that you're clean. You need to really make sure this is clear when you're doing when you're answering an AOT question. So make sure it's clear how the person isn't functioning adequately. So what is happening that shows that they are in distress. So if you take a minute to read this article about Naked Rambler, just pause the video now and have a read. So hopefully you should see that this guy, Stephen Goff, believes that he should be able to walk around the UK naked, and he's been doing that for many years now, and every time he gets arrested for it, and he's often put back in prison almost immediately because he refuses to wear any clothes. I want you to have a think now about how his behaviour would be considered abnormal according to each of the definitions that we've done so far, so the 3 different definitions. And maybe have a think about what your advice would be to the authorities about dealing with him, bearing in mind that it costs them around £25,000 a year to keep him in prison. Pause the video and have a think. So hopefully you should have said that deviation from social norm is one of our definitions, and that in this case he is considered abnormal because it's not acceptable in society to wear nothing. Like, as a society, we agree that we should all wear clothes all of the time. In terms of statistical infrequency, so our second definition, it's rare that anyone would be opposed to wearing clothes. So if we did a normal distribution graph, we would find that most people would agree, or if we did a survey, most people would agree that you would wear clothes in society. And finally, this definition, failure to function adequately, he's not functioning adequately because he is distressing, not himself, but in this case he is distressing general members of the public and those in the prison service by not wearing clothes. And he can't function adequately because he isn't able to avoid going to jail. So he knows that he is going to be put in jail for it, but still can't control himself to put on some clothes, and so he is not functioning adequately. Having a think about what your advice would be to authorities, this would be really interesting to hear your opinions, but have a think about the fact that is it worth them putting him into prison if it's going to cost them that much money, or is it more distress to the people who see him, and therefore is it worth it? So you've got to weigh up the pros and cons of that. Obviously there's no right answer. So if we're thinking about evaluating this definition, there's 4 key points here. We know that some mental health disorders lead to people not showing signs that they're not functioning adequately. For example, psychopaths do function adequately within society. Psychopaths often seem like perfectly normal people, and it's very hard to tell that they're psychopaths, and therefore they're able to get up, hold a job down, go to work, go out with friends and socialise, and lead a perfectly normal life without us recognising that they are psychopaths. So from this definition, you wouldn't be labelled as abnormal or a psychopath because they are functioning adequately. And this is a problem because abnormal behaviours might be missed. Our second one is that there are cultural differences in what is normal and abnormal. So in some countries, people are expected to go without food for a long period of time, and that's totally normal. However, in our country, if that was the case, we would be seriously considering maybe an eating disorder or some other form of not being able to function adequately. And this means that the definition is culturally relative, so it's not universal. There's no universal standards or rules, and that means it's hard to apply. We get inconsistencies across countries again, where you might get diagnosed in one country with a mental health disorder but not in another country, and obviously that can cause severe distress to the person because something that they might feel is acceptable in their culture just isn't recognised by the culture that they live in. The third one is that the criteria is subjective to the individual psychiatrist who decides whether or not the patient is functioning adequately. So that psychiatrist or doctor has the decision whether someone is functioning adequately or not, and that provides them with a lot of power, and that means that we might get inaccurate diagnoses or unreliable diagnoses because one psychiatrist might diagnose you with something and another might not, depending on whether they think that you are in enough distress. However, it does acknowledge that the experience of the patient is important. So it acknowledges that if the patient doesn't feel any distress, then they aren't considered abnormal. And that's really important because if you're happy, then you shouldn't be considered abnormal. And we know that we've talked about in the last one, for example, people with intellectual disability disorder might still be happy, and therefore does it matter that they are statistically abnormal? In this case, the definition says no, that's totally fine. You can have a very low IQ, but because you're not distressed, that's absolutely, and you're functioning adequately, then you're absolutely fine. And therefore it captures the experience of many who need help and covers a wider range of people who might need help. Hopefully this was helpful for you. See you next time.